Okay, just a quick little pre-introduction before I hit my real introduction for the video tonight. It's quite a long video. You may have seen the timestamp. It's around 20 minutes or so, which is longer than I normally try and do. Like normal, I have put timestamps down below, so if you want to go to specific parts of it, you want to skip certain ideas and segments, you can do. I wouldn't necessarily recommend it because it does all kind of flow together. But the reason it's a bit longer than I normally try and aim for is that I'm tackling what is kind of already a contentious issue, and I think is going to become growingly contentious, which is this meme circulating that COVID-19 is just the flu. We heard a bit of this at the start of the flu outbreak. I even said it myself. I said I think it's going to be just like the flu. But the data now are suggesting that it is not. The data is suggesting that COVID-19 is more severe. In the video, I'm talking about a study that was published by the CDC yesterday that looked at a cohort of hospitalised flu patients and a cohort of hospitalised COVID-19 patients, and found that the COVID-19 patients suffered much more severe disease. As the headline, let's say, there was 5 times more death, or more than 5 times more death in the COVID-19 group, along with much more severe symptoms, respiratory and systemic symptoms. However, these two things are very hard to compare. Even though the diseases are similar, it's this respiratory symptomology, respiratory spread, all those kind of things, they are very hard to compare. So I wanted to go into some of the caveats with trying to compare these two and some of the caveats with the study, which is what made this a much longer video than I typically like to do. However, as I say, I think this is going to be something that's going to float around a lot in the news, in social media, in conversations over the next few months, because the Northern Hemisphere is now going into its flu season, and we are going to be hitting flu and COVID together. It's going to be a topic I keep coming back to, as well as studying coronaviruses. I actually do study flu, so things I think about regularly. But I wanted to make this video hopefully a fairly good discussion about the comparison between the two. I'm not going to try and ever be dogmatic on these things, but the data are suggesting that COVID-19 is more severe than flu. Anyway, with that quick introduction said, I'll now lead into the recorded video. Okay, welcome to video number 38 of the Diaries of a Coronavirologist YouTube channel. Today is the 21st of October, and we are up to about 41 million confirmed cases of COVID-19 around the world and about 1.1 million confirmed deaths. So today I'm going to do the first of 2 back-to-back videos talking about COVID-19 and the flu and SARS-2 and influenza, the viruses that cause those diseases. Now, I think I'm probably going to do more than 2 videos on these topics because in the Northern Hemisphere, we're about to go into our flu season, and I think this is going to become something that I cover quite a lot, as it's going to be a flu season combined with continued spread of COVID, and I think there'll be a lot going on with what's being referred to in some places as a twindemic, having the traditional seasonal epidemic of influenza along with the pandemic of COVID-19. Now today I was going to do a video talking about the potential for co-infection with the 2 viruses. So there is some evidence out there that people can be infected with both viruses and develop COVID-19 and flu at the same time. But I was also going to talk a little bit about how it seems that the measures we're taking to try and limit the spread of SARS-2 and COVID-19 may also be impacting the spread of flu, and so whether this will have any bearing on the flu season that we're going into. However, I'm going to talk about that in my video next week because I thought today I'd go for something a little bit more timely and talk about the misnomer that COVID-19 is just the flu. This is something that has picked up a bit of traction again recently. I've seen it on various social media places, and I thought I'd talk about it in this video. The other reason to do that today is that yesterday the CDC released a report in Morbidity and Mortality Weekly reports looking at this precise thing, comparing COVID-19 and flu cases. So I thought I'd talk about that report. As always, I'll put a link to that report in the description for this video if you want to go and look at the direct source for it, but I'm going to summarize it here in the video. In this study from the CDC, they're directly looking to see whether there were more severe outcomes from people that were infected or that had developed COVID-19 and were tested positive for SARS-2, or people that had the flu and had tested positive for being infected with influenza. However, before I dive into the details there, I want to talk about a few caveats to trying to compare these two, because it's not necessarily a fair and easy, importantly, it's not an easy comparison to make. So with flu, for example, we have a vaccine and we have some antivirals with some efficacy. I stress some because there's quite a lot of resistance in the flu strains that circulate, so there's limited usage, but there are some drugs we can give people, and there is a vaccine. Now, the vaccine, which I'll talk about more next week and in future videos, I'm sure, while it's not always 100% effective at blocking flu infection, it is established that it reduces severity. So if you get the vaccine and you get flu, it's not that the vaccine hasn't worked completely, it is still limiting how severe the disease you develop is. So we have some interventions that can limit the severity of flu. So when you're trying to compare the severity of flu to COVID, where we have no treatments and no vaccine, it's not necessarily a fair comparison and definitely not an easy one to make. And what's more, for the treatment of COVID, medical healthcare workers who've been doing an amazing job dealing with this have been having to learn on the fly while we've been dealing with this from January, February time. They've been building the aeroplane as it was taking off, to use a metaphor I heard somewhere else. So in the early stages, deaths from hospitalised patients were at a higher rate than they are now, because there were treatments that were going on that were not necessarily helping or potentially making things worse. So it looked like the overuse of ventilators was possibly making COVID cases more severe or more likely to go to death. So now those are being used less. Now, I've heard stories of people, medical professionals learning about putting people on their stomachs when they were suffering from severe COVID, and that I think it's called proning, that was helping outcomes. So people have been learning on the fly how best to treat COVID, which is why now we're seeing less or a lower rate of deaths from patients that are being hospitalised. So again, when comparing flu, where we have established protocols for treatments and therapies and vaccine, with COVID, where we've been having to learn, it's not the easiest comparison to make. So I just want to stress those caveats before I talk about the data coming up. It's just as something to be aware about and something to give a fair comparison between the two. But with those caveats said, it is seeming to become more clear that COVID-19 really isn't just a severe flu, or isn't less lethal than the flu, as has also been said. It does look like this is a more severe disease. And largely that comes down to the fact that it seems to impact more systems in the body. So there seems to be a broader spectrum of symptoms, and even the respiratory symptoms seem to be more severe. And I'm going to talk about those a little bit when I go into the details of this paper that I keep alluding to. But the other thing I want to say as well, and as an allusion to a future video, there is also this phenomenon of long COVID. There's more and more cases of people who get sick from COVID-19, recover or no longer test positive for the virus, but then have this long drawn out symptomatic phase, suffering, fatigue, and various other things that are hindering their quality of life that can go for months on end. So not only is it about the acute symptoms, but it seems that COVID-19 is also causing these long drawn out symptoms. But I'm going to talk about long COVID more in a future video, because I actually need to read more about it and understand a bit more. As I've stressed in previous videos, but for people who might be watching for the first time, I'm not a medical doctor. I'm sat in a research lab. I do research on the virus and how it infects cells, but because of that expertise, I can also think about the medical side of things. But I do need to do a bit more reading before I can just roll off talking about long COVID and things like that. But like I say, allusion towards a future video, and just tying that in with some of the caveats before I go into trying to compare COVID-19 with the flu based on the data that's been published by the CDC yesterday. And that does finally now bring me to said study that was published in Morbidity and Mortality Reports by the CDC. So here they're trying to compare the two diseases. They took a cohort of patients for which there was hospitalisation data and records, and they took flu patients from the 1st of October until the 1st of February. So October 2019 through to February 2020. And then they took COVID-19 patients from the period of March 1st through to May 31st. So this gave them a group of about 5,400 flu patients and around 4,000 COVID-19 patients that they had hospitalisation records on. And all of those patients, be they the flu arm or the COVID arm, were all from the Veterans Healthcare Association, which I learned today is the largest integrated healthcare system in the United States. So it's a similar population, just those that were diagnosed with flu between October and February, and those that were diagnosed with COVID between March and May. Now, those time windows were chosen very specifically because that frame of October through February was a time when flu was spreading. Flu season typically starts around October, as I was saying, we're going into it now, and typically runs through to around April the next year. COVID-19 started spreading rampantly, or started spreading more broadly in the States in February kind of time, and then ramped up in March and so on and so forth, and the rest is history. But they were trying to avoid any overlap and trying not to pick up the potential for co-infection cases. So they ran from October through February, where there was basically no spread or very, very minimal spread of SARS-2 and cases of COVID-19 to get their flu cohort. They then gave this month gap between 1st of February and 1st of March, and then used that for taking their COVID-19 cases. So it should be noted, and it's not really mentioned in the report that I saw, that there could be cases of co-infection in either cohort. There could be people who were diagnosed with flu who also had SARS-2, but that seems very unlikely because the spread of SARS-2 was so limited at the time. But it's also possible that in their COVID-19 SARS-2 arm of the groupings, there could be people who also had flu. Again, I said I'll talk about co-infection more in my next video. I don't want to make this one too long. I've already got a feeling it's going to be quite a long video. But there could be cases of co-infection in there. Flu still spreads through to around April or so, as I said. So it's possible that their SARS-2 diagnosed patients could have flu. There was no mention in the study, so far as I could see, that they tested for flu in their SARS-2 positives to rule that out as a co-infection. They were definitely positive for SARS-2, but whether they had flu at the same time, we don't know. I think it's probably less likely. As I say, if you sort of think of flu petering out up until around April, looking at March to May, the end of May is a good chance that there will be very few cases of co-infection, if any at all. But I just wanted to put that in as a caveat. However, having so many patients in both sides, 5,400 and 4,000 or so, this means that even if there are a few cases that are co-infections, it's probably not going to statistically significantly impact the data. But I just wanted to give that a little mention that there could be some confounding factors in here. So let's dive into it. We've got our two groupings and we're going to try and compare the two. Normally I try not to read off things, or normally I never read off things when I'm doing these, but today I am going to do a bit of reading just so I make sure I get the numbers right. So age-wise, the groups were pretty similar. For these hospitalised patients, the median age for the COVID-19 cohort was 69, and the median age for the flu group was 70. So pretty similar, slightly younger for the COVID groupings, but not by much. There was a similar prevalence of underlying health conditions, which is also important to note because COVID deaths are largely associated with underlying health conditions, but this seemed equivalent in the two groups, COVID and flu, similar representation. So then we can start to break down what was going on in terms of the course of the hospitalisation stay. What was found is that there was about 2 times higher likelihood of people going into the ICU in the COVID group. So about 36.5% of the people who had COVID were put into the intensive care unit, compared to only 17.6% in the flu group. The length of stay in the hospital was longer for the COVID-19 grouping, so that was 9 days compared to 3, so 3 times longer stay in hospital. And death was also markedly higher for the COVID-19 patients. So of those people, 21% died compared to 3.9%. So in the COVID group, there was 5 times greater incidence of death. So right away, that's starting to suggest that the people who are hospitalised with COVID are suffering a much more severe disease course than those that are suffering that have been hospitalised by influenza. But we can also dig deeper into that data, as was done by the CDC, and see that there's also more severe things going on within the people dying and being in hospital longer. So, for example, within the COVID arm, there was 2 times greater incidence of pneumonia and respiratory failure compared to the people who had flu. There was a 3.5 times higher incidence of pneumothorax, collapsed lungs, and there was a 19 times higher incidence of acute respiratory distress syndrome. So again, within these 2 hospitalised groupings of patients, those with COVID-19 are suffering much more severe respiratory symptoms. There's a longer stay in hospital, there's a higher death rate. So COVID-19 looks like it's a more severe disease. In total, the group looked at 23 associated things. So I've listed off some of the lung, respiratory system associated things, but they also looked at heart problems, renal problems, and liver problems, and so on and so forth. So 23 different things. And in fact, the flu cohort was only more severe in 5 of those. So for example, exacerbations of asthma were more common in the flu group, as were cases of chronic obstructive pulmonary disease, COPD, and a couple of the heart issues. But generally, all the more severe issues were in the COVID-19 group. So things like kidney failure, things like liver failure, things like inflammation of the heart, myocarditis, things like deep vein thrombosis in the circulatory system. So all in all, it really paints a picture that COVID-19, patients who are hospitalized with COVID-19 have much more severe disease than people who are hospitalized with influenza. Now, again, I hit on some of the caveats at the start in the fact that we have treatments for flu. We've been dealing with flu for much longer, so we know how to treat people who have it. We have the vaccine that can limit the severity. So even the people who get hospitalized, if they've been vaccinated, it may still be a less severe course of disease. But if we're just comparing these 2 hospitalized groups from the Veterans Health Association, the largest integrated healthcare facility in the United States, it really paints a picture that COVID-19 is a more severe disease. There's a longer stay in hospital. There's a higher likelihood that you'll be admitted into the ICU. There's a 5 times higher chance of death, and all of the other things, more severe respiratory symptoms, more severe systemic symptoms. So it really paints a picture that COVID is not just the flu. Now, obviously, we are skewed in this population because we're only looking at people who've been hospitalized by either of these viruses. So a reasonable question to ask and to look at is, are people less likely to be hospitalized by one virus versus the other? For instance, if people are much less likely to be hospitalized by COVID-19, then this skew in the hospitalized grouping may not be so important at a population level. For example, if only hundredths of the people who get hospitalized by flu are hospitalized by COVID-19, then those differences will start to level out. But that also doesn't really seem to be the case. So for influenza, we've been dealing with this for many, many years, as I said already, and we have a lot of historical data. So we can model and we can make estimates for how many cases there are and how many hospitalizations there are and all these kind of things. So in the 2019-2020 flu season, the CDC estimated that there were around 1%, or there was about a 1% hospitalization rate. So in the United States. So for all the people who are estimated to have had a case of influenza, about 1% are thought to have gone to hospital. Now, as I say, that's estimates by and large. The hospitalization data is going to be better, but the total case count is largely built on estimates from historical data for flu. With COVID-19 and SARS-2, we're still learning. This is still an evolving situation. We can't model anything on past experience because we don't have any past experience. This is a new virus. So, of course, there's all the caveats about testing. America is probably our best case study. It's doing a huge amount of testing and it has had the most cases. So therefore, it's probably a good one to look at to get any kind of sense of hospitalization rate from this virus. Of course, there may be many cases that aren't being tested, and so our denominator in the sum I'm about to do may be much higher than it currently is. But we can't help that right now. That is a limitation of comparing these two and comparing hospitalisation rates. But as things stand, the cumulative hospitalisation rate or number, sorry, for COVID-19 is around 400,000. So in the United States, about 430,000 people have been hospitalised by COVID-19. And there's also been the 220,000 deaths. And in total, there's been around 8 million cases that have been confirmed in the States. So that's a hospitalisation rate around 5%. So if you just take those numbers as they are, you're 5 times more likely to be hospitalised by COVID-19. And then you've got all of those other things once you are hospitalised that I've been talking about with regards to the study from the CDC. Of course, as I say, those hospitalisation rates are very hard to compare at this stage because we just don't know and don't have enough historical data to really know the full denominator for COVID-19. Even though we are very good with the testing, we aren't anywhere near as good as we should be. So hopefully next time you get into an argument with someone who's saying it's just the flu, or maybe even if you were thinking it and you weren't sure, hopefully now I've given you a bit of evidence that you can use and you can think about with regards to whether these two are comparable. As I've really tried to stress, I'm coming from this, I'm trying to come at this analytically, I'm not being dogmatic, and I have tried to lay out the caveats with comparing the two. It's so hard to do because COVID is an evolving situation. It's changing constantly. We're learning more every day. We have no historical data, whereas we have much better data for flu. But as things stand, it really looks like COVID-19 is a more severe disease, let alone the long COVID, which I'll talk about in future videos. Anyway, with all that said, and sorry that it's been a bit of a longer video than normal, but I wanted to really give it a good shot because I know that this is a bit of a contentious topic. Please do drop a like on the video for the YouTube metrics if you found it useful. Please leave comments and questions below. I really will try and tackle them on this because, as I say, I know it's a bit of a contentious issue. It's one that's floating around. There's the meme growing in social media of this whole thing. So please do leave questions and comments because I may even do an intervening video between this one and the one I was planning to do today that I was talking about at the top of the video to tackle those questions and really delve into this a little bit more. If you haven't already, please subscribe to the channel as well and hit the bell notification thing so that you can get updates when I post new videos. I'm trying to be regular every week, but not always. So subscribing can be useful if you find these videos useful and informative. And as always, please stay safe, wash your hands, wear a mask, and keep calm and carry on. We will get through this pandemic.